Hey, it's Nikki or Beach with my babies. I had my doctor's appointment actually this morning. I just changed my clothes because I'm home and I was helping my kindergartner do his homework. Um, Not that you have to change your clothes to help your kindergartner do your homework, but makes it a little more pleasant. So anyway, I went to the doctor today with my mom, who wanted to come with me and was a little bit nervous and things about what I'm doing. So she came with me, went to the doctor, and I sat down. And my doctor was really great. He was really patient. He went through all the questions with me and explained things. I was able to disrobe, and he was able to kind of reinforce kind of reasonable expectations of what. I would get out of the surgeries and what the difference would be between a tummy tuck or the abdominoplasty and the lower body lift, which is a combination, I found out, of a buttocks lift, a tummy tuck, oh gosh, and then I think like an outer thigh. It like does something to the outer thigh, but because you're lifting. So, sorry. Anyway, I talked about my concerns, and we went through my questions, and I will go through the answers to the questions, and then I'll tell you what I decided later. So, okay, so my first question I asked, why is this procedure the best for me rather than a similar one? We talked about options of liposuction and not having to do a lower body lift and with the tummy tuck. And basically, I'm really self-conscious about the extra skin on my hips and on my lower, well, not really my lower back, it's like the back of my hips that I really have a bother with. And he said that we could do a liposuction coupled with the lower body lift. I mean, with the tummy tuck. The only thing is it would take care of all the fat, but it wouldn't take care of the skin. And if I continued to lose any weight, not only would I then be getting smaller, but then also the extra skin would be even more prominent on my hips, and it would probably just form a different problem. Essentially, like, yeah, I'd get rid of the fat, but I'd stop the skin issue and etc. So then we talked a little bit about a tummy tuck and extending the seam further back to get more of the hip area. And what I found out about that is that they like taper the seam off the further to the back it goes, and then they go as far back as they can that the table will allow. But obviously, I'm laying on a table, so they seam it down that way. And we talked a little bit about what that might look like on me and things like that. So that was interesting. I got some information on that because I was still kind of weighing through things. Too, how long will the procedure take? My doctor, and I'm just not going to say his name just because I don't know, anonymity or something. But my doctor told me that the procedure, the tummy tuck would take 3 hours and the lower body lift would take 5 hours. Now, the reason for the time is because it's an educational hospital, and so there will be residents assisting on the surgery. He wouldn't be by himself, and so things can go quicker in the surgical center when he has assistance. He said if he was doing it by himself, it would be a lot longer. So, so the nice benefit about that is that obviously I'm under general anesthesia for a shorter period of time, which is good for everybody. So, 3, how frequently do you perform this procedure? This is something that he does. He specializes in cosmetic reconstructive surgery after significant weight loss. Through the hospital, and he has performed the surgery numerous times, but in the last couple of years not quite as much, just because of the economy, which makes sense. I mean, obviously there's a significant additional cost for any sort of non-medically necessary surgery. To an extent, I'm only getting so much credited. So he said, not as often in the last couple of years, but he's done it many times. I should side note that my general practitioner is a good friend of his and highly recommends him. So I wasn't really asking that question because I was doubting his abilities or doubting going to him so much as I was really just curious to see, is this his third one he's ever done in his life? And it's not. Then I did not ask, do you have any patients who are surgeons? Because in the moment, honestly, I was going to ask that, and then I decided that that's kind of condescending, and I just want to get a good vibe from that question. So I decided to avoid that question, and then by the end of my questions, if it still felt like I needed to ask it, I would, and I didn't. So I didn't ask that one. Then 5, if you were unavailable on the day of surgery, who would perform it? And he said we would reschedule. And that made me feel a lot better. Basically, I am paying for him to be my surgeon, and if for some reason he was sick or he was unable to get to the hospital, the surgery would be canceled and I would reschedule. And that was nice to hear. So it's nice to know that I'm signing on specifically with him. He's in charge of all my follow-up care, and I'll be able to develop a relationship with him. So, hang on, I'm gonna sneeze. I think. Oh, the allergies here are awful right now. And then what type of anesthesia will be used during the procedure? It's general anesthesia. So just like when I had my sleeve surgery, I will go in to the triage, get an IV. They do an intravenous kind of relaxing surgery to take down your anxiety and things after doing all your vitals and everything. And then when I get wheeled into the operating room, they will do general anesthesia. Part of the procedure as well, because it's general anesthesia, they put a breathing tube in your throat to make sure that your airway is clear throughout the entire process. And that was the same exact thing with my sleeve. The nice thing about this surgery is that I can drink water immediately after surgery. When you have the sleeve, you cannot, because I don't want anything in your stomach for, I forget how many hours it is, but it's a long time, and my throat was so dry from that too. It's awful. So I asked him immediately, I'm like, can I drink water after? And he said yes. So that was good. Let's see. I asked what medical staff will assist with the procedure, and it's the residents that are in training. They'll be observing and assisting with the procedure, and then the nursing staff. So that'll be who'll be present. So more people than in an average facility, but as a teacher, I would be very hypocritical if I said I do not want students around, because I feel like it's important to learn hands-on. Granted, he's doing all the major work. I don't really want unexperienced hands, restitching me up, but it'll be a learning experience, which is fine with me. Figure the more eyes making sure that I'm okay, the better. Let's see. What precautions are used for nausea post-surgery? I talked to him a little bit about how I'm very sensitive to general anesthesia, and it makes me really sick. And basically they would be addressing that with the anesthesiologist before surgery to give me some things, and then they would put some things intravenously to help me with nausea, and then also post-op they would be giving me things and there's a couple different options, like suppositories, there's a patch that goes behind your ear, things like that. So those are some options. What are the risks associated with this procedure? He said that the major risks associated with the procedure is infection. Because it's a large incision. Either whatever surgery I do, it's going to be a large incision. So infection is the main concern. And then obviously there's a potential for blood loss, and so they will not do the surgery if you aren't willing to have a transfusion. Same thing with my sleeve surgery, and I have yet to ever have a transfusion, except I almost had to have one with my second child. That was kind of scary. That was all post-op and not so good. So, but I have no religious reasons or personal reasons why I wouldn't accept transfused blood. So that's those are the two kind of major possibilities that can happen: infection or blood loss. What are the, oh, no, okay, how much physical pain can I expect from the procedure? This is something, obviously is subjective, and we talked a little bit about this. I know that in the medical world, they use the pain scale, the 1 to 10, like how are you feeling kind of thing. We didn't really talk about pain so much in the pain scale, but he did say that they highly recommend the pain pump, and I would have a pain pump for 5 days after surgery, and they would basically have I forget what it's called, but it's a pain dispensing medication right over my abdominal muscles, where they re-sew my abdominal muscles back together, and because that's actually just a repair. They're already separated right now. That's a repair. So they would do that, and then they would have it in a couple other places. And basically the medication's a numbing medication. So I would be using the pain pump as needed to numb certain areas under my skin and around my muscles. He said the most painful part of the recovery is actually the muscles that they sew together. That's going to have the most pain aspect. So that was something that he addressed with me in the pain pump. And so that $400, for the pain pump, So worth it if it's 5 days of numbing. And then what's nice about that, the reason they do that is so that you're not on so many narcotics. You can taper off the narcotics quicker, and you don't have to be on narcotics as intense doses. So there's a lot of good reasons to do the pain pump. So I was glad I asked that because I didn't know why the pain pump was there. I just assumed it was the hospital meds. So that's interesting. How much? What are the possible side effects associated with this procedure? I don't really remember what he said about that. The side effects associated, I think swelling. That if I was in the sun, after surgery, obviously scars are way more sensitive than regular skin. And if I tan my scars, there's a possibility that the scars will never, the melatonin won't fade again like a normal skin. So as the rest of my skin fades, the scar will stay tan. I think scar stretching, if I'm really, really active, they want me to be pretty immobile for a while, and it's not so much for my own health so much as they don't want tension on the seams. The more tension I have consistently on the seams, the bigger the scar. So those are the things. How can I lower my risk of scarring? What can I do? Basically, stay out of the sun and really try to be immobile other than when I'm walking, but try not to really stress and overdo it every day. When can I resume my exercise regimen? That pretty much is on a case-by-case basis. I will be seeing my surgeon probably once a week for a while, and we kind of take it as it goes. So he said if all goes well, right away, get up and walk right away. If we're talking walking, he said 24 hours after the surgery, the first night, we're going to have you up and moving around, and that's to prevent blood clots. Everything else is, I just have to wait and see how I'm doing. How long will the benefits of surgery last? As long as I maintain my weight, it can last for a long time. He said as you age, your skin loses elasticity, and generally skin naturally will just get baggier and saggier as you get older. So I can't rule out natural aging process, but it'll last as long as I maintain the weight that I'm at. If I lose any additional weight, there's the possibility of it being a little saggy. If I gain weight, stretching it out, things like that. So, just staying on task. Let's see, what's the realistic expectation regarding the outcome of the surgery? We didn't really talk about that so much because that all was addressed in the very, very beginning when he was moving my skin around, showing me. And if the procedure takes less time than estimated, is it cost change? And it's a no. And that's because if it's going to change in time, he said it's going to take them longer in the operating room. And if it takes longer in the operating room, there's no additional cost. If it takes less, then they don't generally give refunds. That's how he put it. And I thought that was kind of funny. Anyway, the other couple questions that I actually had that I addressed real quick was had to do with the compression garments. That's something that I was really stressed out about with the compression garments. You can hear my son playing video games in the background. I was really worried about that because my skin's super sensitive, and I'm happy to say that this plastic surgeon does not believe in compression garments, so I do not need to wear them. I am going to have 2 additional drains, however, so I will have 4 drains rather than 2. However, honestly, as much as I hate drains, I would rather take the 2 extra drains than deal with my skin hiving up or having a raw skin underneath these compression garments for a month or more. That's awful. And then the drains will get removed, when they get removed. Average that I've researched on the web is 12 to 14 days. However, when I was talking with the surgery center, they said that it's not uncommon for drains to be into up to 3 months. And it just depends on how long my skin is weeping fluids, on the inside, how much fluid leakage there is. So we'll see, and I'll post more about that. So that was good to hear as far as the compression garments. So based on all the information and based on my doctor, I've decided to go with the lower body lift, and I talked about this with my mom. I'm really confident with my choice, and I'm also really confident with my surgeon and his techniques, and he seems to be a really even-keeled guy. We were joking around a little bit. He's, like I said, good friends with my doctor. I taught my doctor's daughters. We were talking, and he knows them. So I have a really good feel with him. I like that he's conservative. We talked about it. The lower back surgery is actually going to be pretty minimal. They start on the back. They start very, very conservatively. Then they move to the front. And that's where most of the extra skin is. So they'll be more aggressive in the front. And his philosophy about how he's going to kind of approach my skin and my body is something that I'm more comfortable with. So thanks.